informed.
The numbers are alarming. Even though there's been a lot of public awareness about our opioid crisis over the past year, overdose deaths continue to rise. In 2018, the county saw 23 overdose deaths. That number has been steadily increasing since 2012. So far this year, Minnehaha County has seen 15 overdose deaths, and sadly, they expect that number to keep climbing. Prescription painkillers are no longer the big problem when it comes to overdoses.
The dent we're making is we're getting rid of the prescription opiates. You know, we're making changes in doctors so they don't prescribe the opiates. We're reducing all that. So what we're seeing is people transition.
But what they're transitioning to is now the big concern.
People aren't always getting what they think they're getting.
Minnehaha County Coroner Dr. Kenneth Snell says he's seen more overdose deaths related to heroin and fentanyl, or a deadly combination of the two.
If they normally use one drug, what they may be getting off the street is either that drug or a combination of that drug or something else, or another one altogether different. And so we'll see deaths when we know this person normally abuses this drug, they're dying of another one.
To stop the opioid crisis, treatment is the key, but that's easier said than done.
There's still a lot of guilt and shame that go along with this addiction.
Malia Holbeck, manager of addiction recovery program at Avera, says oftentimes people are hesitant to seek treatment.
What we'll do with those individuals is we'll do a chemical dependency assessment with them, because what we really want to do is be able to see kind of the scope of the issue and then be able to determine what is going to be the best plan of care for that person.
Avera provides both inpatient and outpatient treatment and telemedicine to help in rural areas, but unfortunately, there are still gaps.
So not only within our state but across the nation, there's just a lack of access to treatment and a lack of access to treatment providers to really be able to help with these individuals.
Dr. Snell says that the most illegal opioids are coming from overseas, then being distributed to places like Chicago and the East Coast before they'll find their way into Sioux Falls and the surrounding areas. Coming up on this week's Inside KELOLAND, you're going to hear more from Dr. Snell and Malia Holbeck about the crisis and an upcoming vigil to remember those who have died from an overdose.